So the most important thing when putting on a bandage is not to make it too tight. So what you're going to do is, let's say the dog's wound is up here. You want to appropriate cleaning using the technician approved methods, and then use sterile gauze or a Telfa pad, which is a non-stick bandage pad, and place over the wound. The most important thing when putting a bandage on the dog is, number one, don't make it too tight. Number two, it's not okay just to put a bandage strictly around the area, because by doing so, you're actually cutting off blood flow potentially to the rest of the leg. As the dog moves, it's going to flex its muscles, causing that bandage to tighten. So what you're going to do is start at the end of the foot, at the toe, and I like to use cotton. This is recommended. It's going to allow padding, so your vet wrap and other materials are not going to be directly on the skin. And it's also going to allow for absorption. If it is a bleeding wound or an infected wound or anything like that, it's going to help pull it out into this gauze. So you start with the toe, wrap around, and work your way up. Again, not making it tight. You want to leave a little bit of room at the toe so that you can feel the toes and make sure that they stay warm after you apply the bandage, to make sure your bandage is not tight. But you do want it to go all the way down to the tip of the toe. You wrap up to your spot of where the wound is. This bandage is not a bandage that's intended to stay on for a long time. It will fall off, but that is the whole point of first aid, just strictly something that you can apply to get to the vet. So when applying your vet wrap, it's really important not to make it too tight. So a good idea is to unroll it from the wrap first and then roll it back up. That way you're not taking it where it's already tight from the roll and trying to wrap it. You start again at the toe and work your way up. If you pull on it while you're wrapping it, it will get tighter as you apply it. So you don't want to do that. You just want to go slowly and work your way up. A good pair of bandage scissors is really important, because most of the time your patient is not going to be this patient with you, so you need to be able to cut it quickly. And that's it. That'll get you to a vet clinic.